Hello, good evening. My name's Kevin. Today I'm going to be talking about pneumonia. Now, for starters, we're going to have to ask yourself, what is pneumonia? Now, I'm pretty sure that everyone may have heard about it at least a couple times in life, if not all the time. Maybe you knew somebody who had it. Either way, what is it? Well, pneumonia, simply put, is an infection of the lungs, and it can disrupt the function of the alveoli. Now, the alveoli are these really small little sacs that are all over the lungs. And every time we breathe, they fill up with air. And it's there in that specific area where gas exchange occurs. So when you breathe in, you're taking in your oxygen, and you breathe out, you're letting out your CO2. And these little sacs are responsible for it. So in pneumonia, those little sacs, they fill up with liquid, whether that be like pus or some other sort of liquid like that. And I'm pretty sure it's not crazy to see that, when they start to fill up with the liquid, that it's impairing that function, because they blow up like little balloons. You open and then close as you're breathing in, but now they're just forcefully staying open because now you have starting to have liquid fill, and that reduces the oxygen, the exchange abilities of your lungs. So you get a reduction in your blood oxygen levels. It's um, it's kind of scary, honestly. It's almost like drowning without actually being in water. It's crazy. And so, what are the causes? Well, there are a couple of causes, and as I found on the HopkinsMedicine.com, they said that there were three main causes that are reported very often. And the first one is viruses. So, viruses work in the way that we can't treat them with antibiotics, because antibiotics are the reason why they work is because antibiotics have this thing in them called beta lactam. And that is, it breaks open the cell wall, which is why antibiotics work for bacteria specifically. And the bacterial infection, you can acquire these things in many different ways. There, whether it be droplet precaution, contact precaution, it's just being exposed. And so now we have the viruses, bacteria, and fungi. And I'm pretty sure you knew that fungi is fungus, inhaling the spores of the fungus. They can get into your lungs and they can cause pneumonia as well. Because pneumonia, like I said before, is the fluid filling. But this is just a response to these things invading the body, unless it's directly inhaled. You can have pneumonia occur as a secondary effect to the infection. They can go through the bloodstream and end up in the lungs, and you can inhale them and then get into the lungs. Now, how is pneumonia diagnosed? Well, there are a couple of ways. The most common way, and probably the most straight to the point way, is just our common radiograph. They'll go ahead and take your chest view, and you'll be able to tell from there. However, there are other tests that can go ahead and specifically kind of hone in on what's going on and what the severity is of your pneumonia, and they can help determine treatment options. So they can take a blood test, and those blood tests are usually used to kind of detect what virus may be present in the blood or a bacteria, and we can find out what specific bacteria is there, because it's possible that you can even be infected by a bacteria that is resistant to antibiotics. And so without doing this blood test, you can actually end up proceeding with a care plan that is ineffective and lead to further disruptions in the functions and ultimately reducing the oxygen levels. The we have here this pulse oximeter. This is a very simple way. It goes on the edge of your finger, and it measures the saturation of oxygen in your blood. And this is important because it gives the medical staff kind of paints a picture of how well your lungs are working. Because if it falls too low, then they'll know that your lungs aren't properly functioning. They're not doing their gas exchange properly, and the oxygen content is ultimately failing, which is very important because without oxygen, your cells cannot function. And if they're looking for deeper pictures, we can end up following through with CT, as those cross-sectional images can definitely help for deducing if there are certain areas in the lung that are specifically affected. The growth patterns, like in this picture here, is a pneumonia caused by fungi, and they continue to affect the lungs and ultimately lead into the filling of the sacs, as aforementioned. And another test that they can do is the Sputnik test. This, as I was reading over with the CDC, was that they typically would do this exam to see if the pathogen is native to the lungs. Like, instead of cascading through the blood and ending up affecting the lungs as a secondary effect, you can end up seeing if they are of the type that are just in the lungs already, and we can start there with treatment. The arterial blood gas is another test that will help give that clear picture of how well your lungs are producing oxygen, or rather doing your gas exchange. Now, yeah, it's looking for sort of the same answer as the pulse oximeter, but this is a very, very accurate test as comparison to the pulse oximeter, which is using infrared. The the arterial blood gas, they take the needle and they go straight into the artery. They go straight into the artery to get that oxygenated blood coming from the heart. This will paint the most accurate picture of what saturation is, and then leads to further kind of get a better understanding of where the patient is and their infection, what's causing that infection, and how to move forward. Now, as interesting as all this is, it's the big question is pneumonia fatal? Well, the answer to that really is it depends, because in most cases of young healthy adults, that pneumonia won't be fatal. Your body will be able to get over it on its own, and you'll do just fine. It'll be rather uncomfortable and may have a difficult time breathing, but recovery should be smooth and stable. However, there are certain areas in which, or rather groups of people, that are affected much differently. So we see here there are 434,779 deaths from pneumonia in children under the age of 2. Now, this number accounts for up to 74% of all of the pneumonia-related deaths in the age group of toddlers and infants, which is crazy, which is basically shows us that young children are very susceptible to the fatality of this particular infection. The other age group affected, well, that would be the elderly or the immunocompromised. So if we have a person who has a pre-existing condition such as AIDS or even diabetes or cancer, things that are hurting the immune system or reducing healing or potentially just interfering with the immune response, can ultimately hurt your chances of getting over this disease. And so, what can you do? Well, the key here is to always make sure that when you are starting to feel these symptoms and they're getting too bad, always seek medical treatment as soon as possible. Vaccines are a good treatment option when it comes to preventing the viral pneumonia. And as mentioned earlier, we have the antibiotics. This is going to be used for treating our bacterial pneumonias. And in the healthier adults, some of these things may not even be needed. We can simply just give them Tylenol to help deal with some of the pain or discomfort from having the pneumonia as they wait to get over it. So, all in all, the pneumonia is very serious depending on who you are, and maybe not so much. If you don't seek medical treatment and it goes unchecked for a very long period of time, then it is quite possible that you too can succumb to it. So be sure to seek out medical treatment. Be aware of your body's symptoms. And don't play around with this because it's not worth the risk. Thank you, and that was my presentation.